ER experience is the best experience out there. And in this video, I'm going to be going over 5 reasons why ER experience prior to becoming a Psych NP is the best experience out there. So stay tuned. Welcome back, Psych Dude family. It's good seeing each and every one of you guys today. So you probably clicked this video because you're interested in finding out why ER experience is the best experience out there prior to becoming a Psych NP. Yes, I've made videos about why Psych experience is important, but let me tell you why ER experience can actually trump the Psych experience. And this is debatable, but at the same time, I figured why not make a video explaining my process and my reasonings why this is actually the best experience out there. And yes, before all the haters start hating, just watch the whole video, please. And if you are new to this channel, let me formally introduce myself. I'm the Psych Dude. I'm a board-certified psychiatric mental health nurse practitioner. And in this channel, I go over several different subjects to educate the public about mental health, ways to improve your lifestyle, topics related to nursing, nurse practitioners, and specifically psychiatric mental health nurse practitioners like myself. So if you are interested in these topics, feel free to subscribe to my channel. Make sure you give this video a big fat thumbs up. And follow me on Instagram at THEPSYCHDUDE. So let's get started on why I believe that ER experience is probably the best experience prior to becoming a Psych NP. So let's go! So the very first reason why I feel like ER experience is the best experience prior to becoming a Psych NP is you get to deal with all levels of acuity when it comes to medical disorders. Meaning that you get to deal with people that just come in for regular urgent care issues, and it can go all the way to trauma or medically compromised patients, and you get to deal with all of those types of patients. This is especially important because as a Psych NP, you have to understand not necessarily how to treat them, but it's good to know that you know how to treat them. You get to understand how certain things could react, how certain medications can react, how certain disorders can react. And by dealing with so many levels of acuity within the medical realm, you could understand how to treat them and whether or not you can keep them in your unit or if you need to send them out for medical clearance, things like that. And it's important for a Psych NP to understand that because like I said in previous videos, if you don't necessarily understand the medical side of it, you're automatically just going to rule it out and think that, oh, it's a psychiatric disorder, when in fact the medical issue might be the cause. So you have to be able to understand that. And like I said, ER, you get to deal with so much. You get to deal with chronic issues, you get to deal with acute issues, and you get to understand a lot of the medications that our people are on, and you can use that to your advantage, especially as a new provider when you don't necessarily know all of the medications. But if you can experience that within as an RN, it's going to make you that much better when you are a Psych NP and having to deal with so many comorbidities along with their mental health issues. So the second reason why ER experience is the best experience prior to becoming a Psych NP is the fact that you deal with psych patients all the time. So regardless of why the patient's there may be patients that have psychiatric issues that are going there for medical issues. But at the same time, you're going to be dealing with patients that are acutely suicidal, acutely psychotic, and you have to medically clear them first, and you have to be able to understand and treat the patients and understand their behaviors in order for you to successfully treat them. So you have to deal with them. Yes, you don't necessarily do all of the things that psych nurses do, but at the same time you do treat psych patients and you understand somewhat of the process in order for you to be able to understand their behaviors and being able to see which behaviors might irritate them, agitate them, and understand what needs to be done in order for you to help them. Yes, it's tough, but at the same time, it's necessary, especially when you're dealing with an acutely psychotic patient that's extremely paranoid and delusional patient that are extremely paranoid, and you have to do a blood draw. Imagine doing that, and that's what you do have to do sometimes, and this is where teamwork becomes involved, and you have to be able to understand that. And this is only going to help you in the future. It's going to help set you up for success, because in the future, when you do deal with these type of patients, you're already going to understand, okay, this is how we do it. These are the behaviors that we need to observe, and these are the behaviors we need to understand in order for us to treat the patients to the best of their ability. And you do get that experience when you are in the ER, so it can help set you up for not failure, but help set you up for success when actually being a Psych NP. So the third reason why ER experience is the best experience prior to becoming a Psych NP is you get to educate appropriately. So a huge component of what we do in psych is being able to educate the patient and family members and staff. And by being in the ER, you get to do this a ton. You get to do this for patients that are medically ill. You get to educate the patient, you get to educate the parents, you get to educate family members, you get to educate everyone that's a part of their team. And it's going to also help you in the long run when you are our Psych NP, because a huge component of what we do as Psych NPs is we educate. We educate. And that's a huge component. And why not get the experience now when you're educating patients, their family members, about the whole process, on what to expect, on what things to help prevent things, and you're just gonna get into the rhythm of doing that. And you get to do that so much when you're working in the ER, because when you get in the ER, sometimes you have to admit the patient and then admit him to your ER emergency department, and then you get to discharge them, and you get to admit, discharge. It's not like other floors where once you admit them, then you're going to see them for a couple of days, and whoever discharges them then gets to educate. But in the ER, you get to do it all the time, because some people are in and out really fast, and you have to continually educate all the time. So why not learn it in the ER and be able to do it? When you become a provider, it's going to be a lot easier to do. So the fourth reason why ER experience is the best experience prior to becoming a Psych NP is you have constant communication with other providers. And luckily in the ER, you're always going to have a doctor on staff. Yes, there are other units when there's always going to be a doctor on staff, but especially in the ER, there's always going to be a doctor on staff, no matter what type of level hospital you are, level 1 trauma, level 2 trauma, things like that. It doesn't matter. You're always going to have a doctor on staff, on pretty much there the whole time. So you always have the ability to communicate with them. And especially as a new provider, the hardest thing is to be able to communicate and give report to either the next doctor, the next provider, or if you're calling other hospitals and giving a report to that doctor. And it can be intimidating at times. So in the ER, it's easier because you have to have an open line of communication with the doctor at all times, because you're pretty much there at the bedside a lot of the times, and you have to be able to let the doctor know what kind of signs and symptoms you feel or you see in order for them to effectively treat it. Yes, they do their evaluation also, but at the same time, they're not always there, because depending on how staffed they are, if there's other doctors all there all the time, then they might not be at the bedside all the time. So the good thing about being in the ER is you're going to be able to communicate, and it's not going to be as hard because you're going to have the confidence in order for you to communicate to the doctors on what you see and what you feel and what kind of signs and symptoms they need to be looking for. And you get to do that in the ER. Yes, in the psych unit, you get to have that communication with the doctors, but it's not the same. It's one of those things like, oh yeah, they're not depressed, suicidal, things like that. But then for the most part, that's already documented in your notes. A lot of the time, sometimes in the ER, you're not going to be able to document it as fast, and the doctor doesn't have time to review your notes. So a lot of it is just going to be verbal communication going back and forth on what you observe compared to what they observe, and then coming up with a plan on how to treat the patients. So this is going to be a little bit easier for you when you do transition into the role as a Psych NP, especially when you're communicating from provider to provider. So the fifth and final reason why ER experience is the best experience prior to becoming a Psych NP is the fact that you get to gain a lot of critical thinking skills. So let's be real, guys. So in some units, a lot of the things you do are not critically thinking. And what you do is just get the task done and go. And it gets so redundant sometimes that you just do your task and move on. And you don't necessarily have to think about it. You don't have to worry about which patient you need to see first, and you just do it because no matter what, they're not going to die. But within the ER, it's a whole different ball game, and you have to be able to critically think because there's so many different levels of acuity on there, and you have to be able to understand and have time or management skills to be able to help each patient according to their acuity level. And sometimes having to manage someone that's medically sick and manage someone that's mentally sick, it's extremely tough, and you have to be able to juggle those things. And the reason why this is important for Psych NPs is because it gives them a mindset of knowing which patient to treat first and which patient to see first in order for them to stabilize and kind of control the unit. It doesn't necessarily work as much in the outpatient setting because they just come in and see you and then go on their way. It's more so like the inpatient or urgent cares where you have to see the patient, or you have the list of all your patients, who needs to be seen first and who needs to be sent out first, things like that. And you're going to be able to gain those skills, especially when you are working in the ER. Yes, you can gain those skills kind of when you're working in the psych unit. You get to see the different decision making, but at the same time, it's kind of different because if they're sick, they're sick. If they're mentally sick, they're mentally sick. And if they're kind of by themselves, not doing anything, you're just not going to bother them. But within the ER, you have to kind of think, okay, this patient is on a vent, blah, blah, blah. You have to take care of that. Maybe this patient is decompensating while your patient over here, that's a psych patient, is going off on staff, and you have to understand which you need to take care of first and which people you need to communicate in order for you to get the help that you need to get in order for you to take care of both patients. And you have to be able to develop those critical thinking skills, and you can in the ER as opposed to just working psych. So it's one of those things you have to understand which is going to be the best position for you. I'm not saying that the ER experience is, I'm saying it is good experience, but I'm not saying it's the best out there. But I'm saying it's something to think about, especially if you are interested in becoming a Psych NP. I know there's this common misconception, or there's common thought out there like, oh, you only need psych experience to get to become a Psych NP, or you should only get psych experience before becoming a Psych NP. And I've said that psych experience is extremely important, but there are different roles out there and different specialties out there that deal with psych patients, and you have to understand which kind of gets you puts you out there to be in the best position in order for you to be successful as a Psych NP. And this is just one of them. I go over why psych experience is important, and then I'm going over why ER experience can be important for a psych patient or before becoming a Psych NP. So there's so many different roles out there that can prepare you to become a good or even great provider. It's just a matter of trying to look out there and keeping an open mind on why it's going to help improve your skills as a provider. Well guys, I hope you guys truly enjoyed this video. I hope it kind of shed light on other units or other specialties that might help you become a successful Psych NP. I know I mentioned that psych experience is the best experience, but also at the same time I feel that ER experience is the best experience. It just depends on how you look at it. And ultimately, it's your decision on what you want to do. I'm not here to tell you, okay, quit your job as a psych nurse and go to the ER. Nothing like that. Or quit your job as ER nurse and go to the psych unit. Or quit your job at ICU, go to ER. Each unit is different. Each unit has different dynamics. And I've met other people that never had one psych experience a day in their life, but they've had ICU experience and they're phenomenal providers as a Psych NP. So it just depends on what you want and kind of that lifestyle you want also, and what kind of patients you want to treat. Well guys, thank you for staying till the end of this video. Like I said, if you like this video, make sure you give this a big thumbs up because it helps with the YouTube algorithm. It helps with me being known out there. It helps keep me motivated pretty much to keep on making videos for you guys. So definitely please like this video and make sure you follow me on Instagram. And if you are, just DM me, hang out, just talk, let's have a conversation, anything like that. Yeah, so that's pretty much it. I hope you guys enjoyed this video. As always, have a wonderful day. Bye!